Call this meeting to order the Finance Committee on March 25th for the Kern Valley Healthcare District. Called to order. Okay, change to the agenda. Are there any changes?
I didn't have any. I'll approve as presented.
Okay, the minutes are approved as presented. Public comment. There's no one from public. I don't see anyone in the. If there's anyone for the public who wants to say anything, stand up or
Raise your hands.
Okay, financial statement. That would be you to start with.
Yes.
Okay.
Would you like me to go through it or?
No.
Your questions?
Okay, Fred,
My only question that I had is clinical visits have me concerned.
Yeah, that's
fascinating. And that's due to lack of providers. Have somebody talking to us now about I don't know if he's a locum or whatever, but he just gave us his rate and I almost hung up on him because it was so high.
Yeah.
What did you say, 248 per hour?
48 an hour, plus travel.
Yeah, plus travel.
Plus lodging.
That's like an ER visit. The ER doctor is just too much.
Yeah, Greg, you might tune in. Well, you started it and we might as well talk about it because I wanted to talk about that too. That was the one thing. The clinic was making us money.
Oh, it does.
And it was keeping our image. Everybody loved the clinic. You see a few bad reviews and we're not doing good. And
The problem is, Gene, we can't even take any more new patients because
That's the problem.
that's the thing. Not only we're not growing, we're also going
But
down.
we have to solve the problem.
We do.
Okay, well, we don't have to solve. We've got to solve it.
The good thing about the clinic is that you only get the clinic visits, you get x-rays, you get blood, you get PT, you get all this other stuff that's ancillary that doesn't even get credited to the clinic.
Greg, are you there?
Yeah, I'm here.
Okay, Greg, we have to do something. What do we do?
I agree. We have 3 different firms that are doing recruiting for us. I mean, it's a little ways off, but we do have one of our PA students has verbally committed to come work with us, but that's not going to be for a while. That's not going to be until 2027. We have probably with one of our recruiters, we have 3 potential leads with that one. With another one of our recruiters, one of our contingent based recruiters, we're going to be doing an interview there. This is someone that's in a rural California hospital, rural health clinic that is looking at possibilities for moving to a different place. He has interest in our facility, so we'll be talking with him, I think, on Friday. It's rough, and we have these recruiters that we're working with, and unfortunately there's fees that go along with the recruiters too. So I sent an email today to our main recruiting firm that is we're paying they're a retained company, so we're paying them every month for services, and then when we place we pay them a smaller commission. But we've been going for 10 months now with this one firm, and we still don't have anyone. And I don't think it's because of the firm, because I have enough experience with this to know that this is just the hardest thing to recruit for right now. So I'm waiting to hear back from them about renegotiating the rate. But more important than that rate is just finding a family practitioner to come and join us. We're open to PAs, nurse practitioners, but we really need a family practitioner.
Okay, Greg, I don't understand how you do it, but are you able to, would we be better off changing from you to somebody different? I'm asking you, see, between you and me, I love you. You know that. I know how you were. I know the way you treated patients, and you went out of your way on the weekends and you took care of people that were really sick. I got nothing but wonderful to say about you, but we need to do something, and it's not working. And I'm asking you, I mean, does that sound like a cold question?
No, we're bringing in Dr. Newell, who's going to help us a little bit. we were talking about Dr. Carsland probably possibly going to there too, because he's in the ER, but he's on the upswing on the ER, but if he's not, we might bring him, he's another family practice, but I don't think it's eliminating Greg. I think it's in addition to Greg.
Okay. Well,
That's what I mean. We have room for 2 or 3 more.
I don't know your system and I don't know how it works. I'm asking you. I wasn't trying to be cold. I guess I was, but I was being cold, but we need.
I don't take it like that. You know, when I'm out here working, I see my patients remotely. I'm still seeing a good number of patients, but it's definitely not as many as what I was seeing before. I have increased my my days that I'm seeing patients, because I'm taking on a lot of Megan Kajawara's patients since she left. So no, I get that, and ideally it would be great if I still lived in the valley. I still come back, 3 to 4 times a year for to see patients face to face. I just came back a couple weeks ago. I don't take any offense about that at all. You know, we want to increase our volume. We want to make the clinic productive. We want to make it a value to the community.
We don't, more PAs, can we have more, how many PAs can we have? Can we get more of them? I know we got a few homegrown ones. Is the one still here whose mom worked for Alta One?
Yeah, Cody Bogarelli is still working with us.
Forget, we lost a PA and we lost a doctor in the last 6 months or so.
Right, but we lost a doctor that was.
Well, he was seeing patients, so he wasn't great. Don't get me wrong, he wasn't great, but at least he was seeing. He had a panel of patients that he was seeing.
Okay.
But Greg and Miranda are working hard and trying to find somebody. It's just a shortage everywhere.
If we need to change our system, we got to do something. We can't.
It's a good job that we're offering though. 3 days a week, 3 12s is pretty damn good, I think.
Well,
and we just can't get somebody to come up. And we thought we had that one guy, and then he sees where he has to live, and he doesn't. I mean, that's was his excuse. I don't know if it's true, but that was his excuse for not coming up. We had him almost signed and delivered, but
okay, we need to figure.
I agree.
We used to, the visitors council when it was about there, we made a what do you call that thing that you put in a video? Now it's disc and all that.
Yeah,
Back then it was a video, and it showed the derby, a bunch of stuff, fishing, creek. It was a very good one.
Right.
And when we would show it to the people, and we, there's in the base, got a bunch of our copies and show it to the people to try to get them to go from point and go to here to Ridgecrest. And
well, that's what we were hoping to be able to share with somebody with Ridgecrest.
Yeah.
I don't want to share with this thing.
If we can do like the disc that.
Kernville Chamber of Commerce probably has, if you're talking about like a appropriate tool to show how pretty the area is.
Right.
We'll have stuff like that at Kernville.
Right,
Chamber of
if we
Commerce.
Both
can-
chambers have uplink videos that they could download that would just explode what the valley is about.
Right, and show them.
But it's still, I mean, these people, you have to understand too, like if they're truly interested in a job here, they are doing their own research. They're looking at houses, they're doing all this stuff. And if still, after all that, we go through all this onboarding stuff and almost get them here and they say, you know what? We don't want it. It's not
We have to create desire where none exist. We have to create a desire
It's better
for
that
them
they-
to want to come here.
It's better that they don't come, period, than that they show up and leave in 2 months.
Right.
We can do all that.
Right, but if we can create the desire for them to come here, they'll love it here.
Perhaps.
I came here in '84 and they kept trying to get me to leave, but I wouldn't.
Damn it.
So, okay, then that's.
No, I agree with everything you said there. We are trying, Greg and Miranda are trying. I'm getting calls from people and I'm getting emails and I forward it to them, but it's hard to get somebody to come up.
Greg, again, I wasn't trying to put you on the spot. We need to do something to move forward. Okay.
If we can get Greg to come here a little
I
forward.
agree.
Did you
That's
have-
why I'm here today.
I'm good with it. My concern was simple, we need to do whatever we have to do.
Right, if it
If it
takes
means-
money, at least
Well,
temporary.
Using different headhunters, whatever it may be, just
Yeah,
gotta
whatever.
get a little more aggressive. That's all.
Okay, I hear you.
That's my only comment.
All right. And if we need to raise our rates, we might have to, but the problem with that is if we raise our rates and pay more than Dr. Monger is making, she goes berserk.
Yeah, she doesn't like it when other people make more than she
No,
does.
that's
She's
good.
been there and
Do you
she's
blame
an
her?
awesome doctor.
You know, but
And
she's got a pretty good thing going.
yeah, she does, and so do we.
Right, right.
So it's a good thing,
I
but,
agree. But we might have to raise our rates. I mean,
right,
that's-
right.
We gotta try something different. I agree with you, but
Put it this way, losing the number that we're losing doesn't help the bottom line. That's all there is.
no, it hurts. And like I said, all the ancillary revenue. is
Correct.
That's the biggest problem.
Is anything gonna change, Carrie? With AI, I know I keep saying AI and you keep saying it's gonna go away. It's not gonna go away.
Never said that one.
Well,
He's
you
using it.
basically almost the same as said it's gonna go away.
Not at all, Gene. That's never what I said. I never said it was gonna go away. I explained why we're being cautious and we're not using it in a
Okay.
medical setting. We are using AI in a number of areas for productivity around the hospital.
Okay.
Is it gonna replace a
As far as-
PA? It's not going to replace a
As far
PA.
as far as the industry goes,
Never said that
is
either.
it gonna help us put less workload on a nurse, less workload on a doctor?
The only less workload it could potentially provide on a provider would be something that we are looking into, and I included in my last report.
Okay.
Was that there's Dragon Copilot,
Right.
where that potentially will ease some of the documentation load on providers, and that's something that we're actively looking into.
Will it allow us to change to where we can have more PAs per
No,
doctor?
it's not going to change the regulation.
Okay, well, yeah, it could, because.
Well, I
things
wouldn't
change.
know if it would be able to change the regulation since I'm not writing the regulation.
Okay, I know, but Insight, back before it had to be a doctor, and there were no PAs. Now there are. They came from somewhere.
We would have to petition whoever writes
Okay,
these things. Yeah.
is there anything in there about something like that, maybe?
No,
Yes, there is. So what, we talked at a few meetings ago, I think on January 1st, we had a change of the PA to physician ratio, where it used to be 4-1. It changed to 8-1. But the other aspect that came along with that bill was to alter the way that PAs are treated by the different insurances. There's very few insurances that allow a PA to be to have members' lives assigned to them. So with part of this bill was investigating more autonomous practice, kind of like what nurse practitioners have in a lot of states where they can practice independently. If that were to happen, we basically would have, we would keep Dr. Mongar as long as we could, but basically probably our entire clinic would be run by PAs and nurse practitioners.
but not specifically because of AI.
Has nothing to do with AI.
Or AI will
Has
help.
nothing to do with AI.
You know where AI will
Well,
help Gene is in some of the support,
Indirectly,
some of the support,
because of workload.
some of the support play, some of our like buildings and things like that. I think AI, we need to kind of start to incorporate that eventually.
But as far as providers, we deal with very few insurance companies here. We deal with Medicare primarily. And the HMOs through Medicare. Will they accept that ratio? Do you know, or you have any ideas?
The ratio is a state ratio for the legal practice for PAs and the relationship with PAs and their supervising physicians or collaborating physicians. So that part doesn't change. There are some Kern Family, our biggest Medi-Cal managed care Medi-Cal provider, allows the PAs to have lives assigned to them. So that's very beneficial.
Yeah, okay.
In fact, I probably have most of the lives assigned to me because I was there for so long. We always said, well, put everyone on Greg. He's going to be there, forever. So, but we have all of the PAs, and Dr. Mongar have patient lives assigned to them.
Can we grow them from here like we did, what's his name?
Cody.
The girl
Cody, we have actually one nurse who's who's worked at our hospital that has interest in joining us full time when she's done with school.
He went on his own.
We've got a few of them like that, right, Greg, that are, when they're graduate, they said they'll come here.
We have at least her. I spoke to her when I was in town last, and she's she's verbally said that she wants to come with us. So that's good.
So we can get more PAs. Can we get more? I mean, even if we
We're
get them a
looking
little
for
more
those
money?
too. Get those posted.
Okay, you guys got it under control, right?
Wouldn't say that right now.
Well,
We have our process down. Maybe we need to tweak it a little bit.
It's not just the clinic, it was helping us.
Oh, I know. That's where everything starts. I agree with you there.
Brother,
We
you
need
got-
growth. We need growth there. The only way we're gonna grow is, that's one of the big growth areas that we have some potential for growth. Because we've got excess capacity there if we just find the providers. We've got room for 2 or 3
we
more
got
providers.
potential for growth. I got to 30, from 34 to 36 fans this morning. And so, does anybody else have anything to say about what we're talking about? Period, it. Okay,
It's something we talk about all the time, so. I know there's a group of people that are trying to recruit.
okay,
Good.
then,
Gee, thank you.
then, okay, he's the one that stopped you this time in the middle
No,
of
that's
giving
fine.
your report.
Yeah, no, that's a good question. I mean, I was gonna talk about that too, but we know that that's a place where we are falling. We were below budget. That's probably one of the only places. Well, we're below
Yeah.
budget a few other places. We're
That's
significantly under
right.
budget. Yeah, right.
Okay,
But still, it's a matter of getting providers because we have not taken new patients for how long? A year almost, I think now.
yeah.
Maybe longer actually since I've been there. I don't think.
If we can shift Dr. Mungar to for Medi-Cal to the other ones, if you can do some shifting, get creative and just make it happen.
She's credentialed with all those people. She is already. Yes.
Right.
She can see have a patient.
You're working. with-
Wow. Yeah. Every one of our providers is credentialed to see any patients. So that's not really an issue.
It don't seem like with doctors, it's getting get better. The population's getting larger and, but people are getting less sick because AI, I keep saying AI and I don't know a damn thing about it. But people are able to take care of themselves better and see less doctors.
True.
Again, I'm sorry.
No, you didn't bring it up. I mean, if you see our ER is going crazy right now. Last month was one of our biggest ER days visits we've had in a long time.
Yeah, we got to get out there with a bat, right?
700 people over something. Besides that, I think we're doing pretty well. I mean, our payroll is a little bit high right now, but we also have a couple of people on, what do you call it, severance pay that's going to go away in a couple of months. And that's why it's going to go down a little bit. But we're also looking at FTE creep like always. We're trying to look and see if positions are necessary when somebody leaves, if we're going to fill them. Now, in some of the positions we have not filled.
Yeah, I know too, there's some severance pay, right?
Yes.
And that won't go away real quick, but it'll go away.
One's going to go away in May, one's going to go away in August.
That's,
It's not that.
depends on where you're at, if that's right away.
I know. Yeah, I mean, and that's gonna be a big deal. I think that those are two highly paid people too.
Cool, yeah.
Besides that, we're looking at overtime. We're looking at expenses, the budget process. Amy and I are starting the budget process. And we are going to need to justify every purchase service and professional fees. And we just need to start cutting. That's all we can do. We need to look at expenses. We gotta say no to a lot of things too.
Yeah, okay. All right, then it goes into, you did the financial report, contract review. Amy, is that you?
Do you have any questions on the contracts?
Uh, The JW and Associates,
That's our auditors.
yeah,
That's the guy who was here last.
we paid that guy $42,000.
Got a deal on that, Gene.
You know what he did? He said the same thing I've been saying for 7 years, ever since I've been on here.
Sorry.
If it's not gonna make us money, we don't need to spend money putting it up.
I agree.
And unless we got the money.
Well, we've got the money, but we need to hoard it for a little while until we figure out what's gonna happen in the future. I mean, we are strong financially. Don't get me wrong, we're strong financially still. We've got reserves. But we also need to be careful that we just don't get crazy and start spending
Yeah,
like a drunken
Yeah,
sailor.
then figure we're gonna remake it when we can't.
Well, that's it.
keep up.
Our IGT is still very effective for us. You know, we got, what did we get in March?
Over 6 million.
$6 million. We got March. It's not reflected here. So next month, we'll show that. And that's a good thing. It's going to continue. And we just got the money for QUIP also. And Greg's people did a real good job on that. Got
Yeah, he's good. I hope I didn't insult him. I think.
I think he left.
No, he's still there. He left his space up.
But that's something we need to expand it with.
He is one awesome PA.
Oh, I know. People
And so,
like to come to us. Oh.
and I'm just thinking of what we can do to help. Okay, the 42,000, I remember it was 24,000. Was it last year or year before last?
Oh, I know.
It's been a
That
while.
last
since
year
it's
was
been
40,000.
It was the same. We had a 3-year contract with them. They can raise it every years.
Several years ago it was 24. It's been
Okay.
a while.
It's
Yeah.
when you first started.
No, when you first started.
But, I mean, if we went to somebody else like Whitley, that would be probably 65,000.
Yeah, he did a great job and I like, I like the summary or the thing that.
He gives a good presentation. I think.
Yeah.
He's good. I've worked with him for 15, 20 years. So he does a good job.
Thomas Refuge. If everybody took their trash home with them,
We'd save some money, yeah.
One bag per person a day. That's all we have.
That's it. I mean, the other place we're trying.
I don't have any questions.
I don't.
We're trying to cut down on the registry too, but that's a matter of finding people too, nursing. Our CNAs, we got registry CNAs. I know we're trying to grow our own, but we may not be able to do a program this year either. Haven't heard that yet. If we can't do that, we've got really.
No, I hate to keep asking that, but is that, is with CNAs, is the internet gonna help them? AI,
Seeing what?
CNH.
Oh,
I think if AI is gonna help them.
okay.
I don't know how it would.
If you have a question, it's right there, so if they, you know what I'm saying. If they need information's available right now. You ask AI something.
Are you saying if a CNA has a question on something that's within their scope of practice, can they utilize AI to get that answer? Is that what you're saying?
Yes. Or could we use volunteers to use AI instead of CNAs?
No,
No.
There's regulations there that
Yeah, you can.
thankfully are in place to
Yeah.
make sure that only medical professionals are taking care of patients.
Okay,
The other thing we're trying to
But
do,
we're
Shannon's do.
we're doing what we can.
Shannon is going to send 3 CNAs, I think, down to Bakersfield for training. Is that what it is?
I'm gonna try, but it's not till August.
I'm not sure.
3 resident monitors.
Yeah,
to get them
Trying to
certified.
train them.
yeah.
That's what we're trying to do, train them, CNA, LPN. We've done that for 3 or 4 of our nurses already,
Yeah,
Yeah.
we've had some.
and that's a good thing. I mean, it's been learning our system and then
Okay.
it rise up through, but
But
No.
to kind of answer your question, Gene, if your question was, can they use AI to query a question or something like that?
Yeah,
The answer is technically, yeah, they could get on some AI engine online and do that. However, it's not something the hospital would get.
okay,
behind
that's
at
what I'm
this
saying.
point.
We have a program that's
We do
AI,
Not.
they can, okay,
It exists out there in the wild.
no.
However, we would not encourage it.
Yeah, no, I'm not
use
talking
AI
about-
to do that because unless it's been vetted that it's going to
Right.
give accurate medical information,
Right,
it's a very dangerous.
I can't believe
What if,
there's.
what if AI told them to do something
Yeah, no,
because it's outside of their scope or
Yeah.
not the proper way to do it? It's
I
not
can't
something
believe
wanna
we
do.
don't have a system that way in the industry that we could get our hands on cheap.
I don't know for CNAs if it would be really beneficial. I mean, they go to school, they learn how to do this job, and then they do that.
Might
job.
make their job easier and quicker, might make it easier. I don't know.
A lot of their stuff is hands-on,
Yeah, I try to stay out of that area.
and they're not making any medical decisions where they would need to do something. like
they're
that.
not passing medicine.
Okay, I try to stay out of there. I don't even go close to it. So,
God help us if you did.
Man.
okay, contract review. And are we down to capital expenditure?
I think we are.
Yes.
We're running a good meeting, Gene. We're almost done.
Well, everyone has looked at these. I know Fred has and I have, and everything is going along. There's not much changing to make other than what we talked about. There's no point in
Right.
reading stuff that you can see, as far as I'm
I
concerned.
agree.
Capital expenditure request for,
Telemetry boxes. Because we ran out a couple times and we couldn't admit patients because we couldn't place them on tele because we only have 7 currently.
thank
So
you
we
for
had to
asking
transfer
for
them.
it,
Yeah,
because if we need them,
we need to keep our patients
we
here.
can't put them in if you don't ask.
Mhm.
Fred, I think we should send it.
The cost is minimal. I don't
Yeah,
know how
it
you.
was.
The
And,
reason
and
there's not comparable quotes is because they have to communicate with the system that we have now, so we have to buy them.
The advantage is
We lost-
that expensive for what.
we
we're
lost
gonna get
business
back.
over it, and we don't want to do that. So, we'll send it to
So,
forward.
Yeah, three patient database.
back.
Now, do I have to adjourn?
You don't have to. So
What you can do is just get up and leave and leave the rest of us wondering if we're adjourned.
Does anybody have anything else? I don't want to make it a half hour meeting. We gotta go, we gotta talk till 1 o'clock or 2 o'clock.
We have other work to do too.
Okay, meeting's adjourned.
All right, thank you.
Have you good day.
Greg, I hope I didn't hurt your feelings or, because everything about this up. And I
Nope,
didn't,
we're all good.
I didn't realize you were still seeing our patients. And thank you.